Hi, good morning, Rowan. My name is Mihiraa. Let's start the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
Your preparation time is over. You can now start your role play.
Hello, Mihiraa. I can see from our examination that your joints are quite swollen, particularly in your hands and wrists, and it is clear you are experiencing a lot of discomfort today. I can completely understand how challenging this must be for you, especially while caring for a 4-week-old baby after a major surgery like a C-section. Dealing with severe pain and morning stiffness on top of newborn care is incredibly demanding, and I am here to support you through this. Today, I would like us to look closely at what you are currently experiencing with this active rheumatoid arthritis flare-up so that we can find a safe and comfortable way forward for both you and your baby. To help me understand your situation a bit better, could you tell me how you have been managing these symptoms at home so far?
Thank you, Nurse Rowan. It has been incredibly tough. Honestly, the stiffness in the morning is so bad that I can barely hold my baby to feed her, and my wrists feel like they are on fire. Right now, I am not taking any pills because I am terrified of chemicals getting into my breast milk. Instead, I have just been rubbing a natural herbal gel onto my sore joints. I am trying my best to just push through the pain because my baby's safety is my absolute priority.
It sounds like you are dealing with an immense amount of physical pressure, and your dedication to protecting your baby is truly wonderful. Mihiraa, now that we have identified that your rheumatoid arthritis is indeed in an active, severe flare-up, I would like to look a bit closer at your current routine so we can ensure everything you are using is completely safe. To help me get a clearer picture of your daily management, could you share a few more details about this natural gel?
I bought it online from a natural wellness website after reading a blog post written by another mother who said it cured her joint pain after pregnancy. It is an herbal relief gel made from a blend of essential oils and plant extracts. Because the pain is so constant, I have been applying it heavily every 2 to 3 hours all over my hands, wrists, and even near my abdomen, where my joints feel achy. I figured since it comes from plants and goes on the skin rather than being swallowed, it must be completely harmless.
I completely understand why turning to a topical, plant-based product felt like the safest choice, especially after reading a positive review from another mother in a similar position. Before we discuss the safety of different treatments, I want to make sure I fully understand your perspective so that we can address your exact worries. Mihiraa, could you talk to me a little more about what specific fears you have regarding taking oral medication while breastfeeding, and what makes you feel that a natural gel is inherently a safer option for your daughter?
My absolute biggest fear is that an oral medication will pass directly through my breast milk and harm my baby's development or cause long-term side effects. When you swallow a pill, it goes through your whole body, and that just feels so risky for a newborn. With the natural gel, I feel like it just stays on the surface of my skin, right where it hurts. I believe natural ingredients are inherently safer because they don't contain synthetic chemicals that could disrupt her fragile system.
Mihiraa, your instinct to protect your baby from unnecessary risks is completely valid, and it makes total sense that a pill feels more invasive than something applied to the skin. To help ease your mind, I would love to explain how the specific medication the doctor prescribed actually works, and also share some important safety facts regarding and proven natural remedies. The oral disease-modifying antirheumatic drug, or DMARD, that has been chosen for you is actually exceptionally well-studied in lactating mothers. Medical evidence shows there is a negligible transfer of this medication into breast milk, meaning the amount that reaches your baby is so tiny it is considered completely safe, which is why it is fully endorsed by leading expert rheumatology and pediatric bodies worldwide. On the other hand, proven natural remedies like the gel you are using are unregulated, meaning we don't know the exact ingredients or how much is absorbed into your bloodstream and potentially into your breast milk. Furthermore, these gels lack proven efficacy for a condition as serious as rheumatoid arthritis, and applying them so frequently can cause severe skin irritation, which is especially risky if it gets anywhere near your healing C-section surgical wound. Knowing this, how do you feel about the balance between these two options, Mihiraa?
I didn't realize that natural products could be unregulated or that they could actually absorb into my bloodstream and reach my milk. It is reassuring to hear that the doctor's pill has been so heavily studied by experts. But even if I am still a bit nervous about the medication, what would happen if I just decided to stop using the gel and tried to bear the pain without taking anything at all?
I can hear your hesitation, and it is completely normal to need time to process this shift in perspective. Mihiraa, to help you make the most informed decision for your health and your family, I need to explain what happens if we leave systemic rheumatoid arthritis untreated over the long term. Rheumatoid arthritis is not just simple joint soreness. It is an inflammatory condition where your immune system attacks your joints, and without proper medication, it can cause irreversible joint damage and permanent deformities. Additionally, the constant active inflammation causes severe chronic fatigue, which will progressively impact your ability to perform daily child care, lift your baby safely, and recover smoothly from your C-section. We want to protect your body so you can actively enjoy watching your daughter grow. Does understanding these long-term risks help clarify why treating the underlying inflammation is so vital, Mihiraa?
Oh wow, I didn't think about permanent damage or how the fatigue would affect my ability to care for her long term. That definitely changes things because I need to be physically strong for her. If I do decide to start this medication, are there other ways I can manage day-to-day life right now while waiting for the medicine to kick in?
Mihiraa, I am so glad we are looking at your overall well-being, and there are absolutely many practical strategies we can implement immediately. To give you some immediate relief and support your body right now, I want to outline some postpartum modifications and treatment recommendations. For daily comfort, I highly suggest using a specialized breastfeeding pillow to support your baby's weight, which will protect both your painful arm joints and your abdominal incision from strain. It is also crucial that you ask for assistance with lifting heavy items, use cold packs on your flared joints to reduce swelling, and practice gentle stretching to prevent morning stiffness. As a formal recommendation, we advise that you start the prescribed DMARD medication as soon as possible to halt the inflammation, and for your own peace of mind, we will closely monitor your baby for any changes in her feeding or sleep patterns, though none are expected. How does that plan sound to you?
That makes a lot of sense, Nurse Rowan. Thank you for explaining everything so clearly without making me feel bad about my worries.
You are very welcome, Mihiraa.